In Chapter 2, we'll be talking about the services and tools available to support a person with a learning disability, including annual health checks, my purple folder, and my health information pages. We've established the difference between a learning difficulty and a learning disability, and throughout this chapter and this film, we'll be talking to Gavin, who you've already met, and Georgia and Chloe, who will also be sharing some of their experiences with us. First, we'll be talking to Hilary. Hilary, can you explain a bit more about the enhanced health service that's available to a person with a learning disability?
That's right. So you see, we all mix up this language. It's an enhanced service. So once somebody is identified as falling into the criteria to be on the GP's learning disability register, then they have enhanced services available to them. So when we say on the learning disability register, if you imagine that every person has codes next to them for conditions they have. If you've got diabetes, that's got a code next to your name. And if you've got a learning disability, there's a code the GPs can use for that. And then when, for example, when COVID happens, it means immediately the GPs can pull up the names of all the people who've got a learning disability who are then entitled to the COVID vaccine earlier than their age bracket. So that's how it works. Now, everyone who has that read code of a learning disability is entitled to an annual health check and obviously to COVID and to flu vaccine. So they're the two immediate areas. And then in adult services, as learning disability nurses, we also would then support GPs to overcome any health barriers with anyone who's on their learning disability register. So that's the sort of loose term of how it works. So when we look at annual health checks, this is a really key area, and you're entitled to an annual health check from the age of 14. And so many people don't take it up, even if the GP invite them, because they're thinking, gosh, I see so many health professionals. We go to, see someone for his epilepsy and somewhere else, paediatricians. So people tend to think, oh, we've got lots covered. But the annual health check is so important. It's the starting point of ensuring that all of their baselines are known and worked on throughout their lives. It means that the person becomes standardised and understanding that once a year they have a really detailed health appointment. People with a learning disability sadly do die younger than the rest of the population, and a lot of that is because of delayed diagnosis. Delayed diagnosis is because if somebody can't communicate or understand their own health, they're going to be less likely to be found for a diagnosis as early as possible. An annual health check helps with that. So there are so many elements, and we will touch in another chapter on some of those core health areas that are covered. But if you saw it as this is the moment to have a top to toe, real look to ensure that steps are taken to reduce that risk of delayed diagnosis. That's why we encourage someone to go for an annual health check. Then we have the flu vaccine. Respiratory conditions are the leading cause of death in people with learning disabilities. Swallow reflex is a really complex reflex. So if you imagine if you've got an intellectual disability, your brain is more likely to have difficulty with that complex reflex. So you're more likely to get chest infections and more prone to those sorts of conditions. So that's why flu vaccine is so key in getting that when you've got a learning disability.
So that's really helpful to hear about the GP service. So what additional support is offered from adult social care?
Yeah, so the Learning Disability Nursing Service sits within adult social care, and we have our health liaison team, as I'm sporting the badge. So the health liaison team has created the purple folder. And this is available to people over 18, but again, we have listened as part of your practice, that we've developed one version of this for children age 11 and up. So it's pages that people can self-print to get into the realms of using this before they reach adulthood and then transfer it across.
And that's the My Health pages?
That's correct, yes.
Right.
And that's available on, you can tell me that.
On the local offer, the Send local offer page.
Fantastic, but that's all in the guide as well, isn't it?
All the links are there.
Yeah, so the purple folder or the purple health pages are absolutely critical for the barriers that we face. The way we say it is that health professionals have a blank jigsaw puzzle in front of them. Now, if they don't get the pieces, they're going to end up with delayed diagnosis. Now, as parents, parents are very good at giving the pieces to a GP, but as someone progresses into adulthood, there is an element of parental voice maybe not there because they've moved out of home, and also people have control of their own health from the age of 16 upwards. That is an expectation that they have their first voice and they have a lead on that. So it's really key to get as many pieces in the puzzle to help GPs. The purple folder really helps with this because we've got on there sections about things like what I look like, communicate like and behave like when I am well, and what I look like, communicate and behave like when I am unwell. Now, parents are the absolute experts in the person that they know. They know all those nuances of things that are indicators. They've got their history. Getting that down will help carry that on. I can tell you a story of a guy that I worked with who went to a care home, and this chap was absolutely screaming the place down. He'd smashed furniture, he'd broken the window, he'd bitten his arm, he'd hit his head against a wall. He was in a really bad state. Now, I'd gone to do a training session, but sort of could hear this mayhem going on. Said, right, talk to me, what's happening? And they said, oh, he's not in a good way. And I said, oh, is this his usual behaviour? I said, no, he's always calm and quiet. He's a really mellow guy. And so I said, well, have you spoken to the GP? Yeah. The GP's, going to give him something to calm him down, and then we'll see in a couple of days whether he can get a physical examination of him, just in case it's something health orientated. Now then a member of staff said, yeah, I know what it's going to be. It's going to be the 8 socks. He did it 15 years ago. I've worked with him a long time. Last time he ate socks, he did this. I said, did you tell that to the GP? No. That's a piece of the jigsaw puzzle. That is a massive piece of the jigsaw puzzle. And they hadn't told that to the GP. Now that is so core. His way of communicating excruciating agony is to throw furniture. He doesn't need something to sedate him. He needs surgery. He was in theatre that night, and actually, as a direct result of me ringing the GP and saying, no, he is communicating. If he was verbal, he would currently be saying, help, I'm in agony, do something, this is an emergency. That's what he would be saying if he was verbal. The GP then got him in, and he'd eaten 2 pairs of socks, and he probably wouldn't have survived till the next day, let alone to 2 days later. So that's a prime example of how health professionals have a duty to look in this. You can use your intelligence that you've gathered as parents to be able to really put messages across. We've also created purple cards. We've also created, which just have a brief amount of information. We also encourage people to use health apps to store that sort of information. And we encourage people to do something called a Me on My Best Day. And that's a short video just saying, this is what I look like, act like and behave like on my best day. Because if a health professional's not listening to you and is saying, no, we'll deal with that tomorrow, you go, bam, that's him, this is not him. And then that gives them that core message of how to work with someone. So I think we can show you a couple of those examples of that, what to put on that. So to create one of those is so important.
I work at the Open Arena. I walk up to the Open Arena every day. I enjoy it because I like meeting new people as well as helping them, show them around the theatre.
Great, thank you. So it's my purple folder, my health pages, making sure that you get that annual health check, and then also doing that Me on My Best Day. Whether you record that in your purple folder or on a separate piece of paper or the Hear Me Now app. So keeping
Absolutely.
all of that information together. That's really great. Thank you, Hilary.
So Gavin, can you just give a bit of an insight from the perspective of a man with a learning disability, how the adult purple folder helps you.
Yeah, no, it is a really useful tool, and actually last year I forgot to take it with me to hospital. I ended up having to go to A&E, and just in the worry I left it behind. And when I was there, because it was in A&E, it was very noisy, I got very overwhelmed, I was getting quite anxious and things, and with that, because I was getting overwhelmed and anxious and anxiety, I think they just thought that was just part of my learning disability, when actually in here you see that I've got it in here about my anxiety and how it makes me feel, and I just wished if I'd taken that with me, they would have seen that actually that wasn't just my learning disability, that's just how I am when I get frustrated and anxious and worried.
Right. So, and how do you present when you're anxious? What happens?
I get very, very overwhelmed, so I can start crying just at little things. I can get very worried. I might start just saying yes, yes, yes to anything because I just want to get out of there. I might start getting very nervous, keep asking the same question over and over again, or I might just go completely silent and not say anything at all, and things are just very jumpy.
Right. So, and if they'd had your purple folder and they'd read that, then they'd have known that they needed to support you to reduce that anxiety, to make sure you got the same health outcomes as someone else.
Exactly.
Because
yes.
instead, you can just get anxious and leave, can't you?
Yeah.
You know, and miss out on the healthcare.
Yeah. I was very close to walking out that day just because of how worried and scared I was.
Yeah. Okay. And then what I forgot to mention earlier was the yellow pages. I'll ask you what your experience of these are in a minute, but let me just first of all explain what the yellow pages are. So the yellow pages are where health professionals write just a very brief bit about what they've seen someone for. Now, it should be very brief. It's not a full medical record. It's just a brief summary, and it's back to that jigsaw puzzle, because if they can see where else they've been, they can begin to get the full picture together. And unfortunately, all health systems do not talk to each other. As much as we dream that they do, they don't. So this gives that instant, quick oversight. So one story I've got from this was a man, again, lived in a care provision, and he had started having falls. He started disengaging. He stopped watching telly, stopped cutting out pictures from magazines. He was noted to be sleeping more, and he was very disorientated. Now, this man was approaching 40 and had Down syndrome, so the doctor put all the pieces in the jigsaw puzzle and made an assumption that this man was probably starting to experience early onset dementia. A fair assumption. But what he didn't do was read back on those yellow pages to make that clarity of the situation. The man was referred on to neurology to establish what was causing his disorientation, and the neurologist actually read back. He looked at those yellow pages and asked, when did it start? And when he looked back, it started in February, suddenly. When he looked at February, the man had got a new prescription for glasses in February. He was disorientated, he had his eyes shut, he wasn't interested in the television, he was having falls when he walked. He couldn't see out of his glasses, and that meant he had 3 months of looking through incredibly difficult to see glasses and lost 3 months of his life because the doctor didn't look at those yellow pages. So that's why it's key that we push health professionals just to write a little snippet on them to keep that jigsaw puzzle built. Gavin, what's your experience with the yellow pages?
The yellow pages in the purple folder are really useful. So one time the dentist actually wrote in there that I have anxiety, and then I went to have a scan done at a hospital, and the hospital nurse who was looking in my purple folder saw that I have anxiety. So straight away she was able then to talk to me about that anxiety and what kind of triggers me off, what makes it happen, what things to look out for. And then with that, she was able to make reasonable adjustments for me so I didn't get anxiety about certain things.
Right, okay, so she was looking back at your yellow pages of where you'd been.
Yes.
And saw that the dentist had put that they hadn't been able to treat you because you were too anxious.
Yes.
And then she had made reasonable adjustments to ensure she could give you the same health outcomes as someone else by overcoming those anxiety barriers. So what a fantastic professional she was.
Yes.
But, you know, that's a really good example of how the Yellow Pages can help. Thanks, Gavin.
Yeah.